Okay, thank you to the chairperson. First, I would like to thank the organizer for inviting me to talk today, and we are going to talk about blood glucose monitoring, when, how frequent, and why. I also would like to thank Dr. Hazanin for inviting me to be part of the writing community, and to our chapter lead, Dr. Suziani, who helped me to conceptualize the idea of this section, and of course to the final editorial team who made the final edits to the section. Okay, so for this session, I'm going to just briefly introduce about the current state of blood glucose monitoring during Ramadan, and then the previous recommendation for blood glucose monitoring, and what are the limitations of the recommendation, and how we have taken that limitation and come up with updates and the rationale for our updates. Yeah. So we will start with the adult global survey 2022. So again, we have 12,529 respondents. Out of them, 43.7% on insulin and 38.8% are on sulfonylurea. We notice that most patients, they monitor at the same frequency as before Ramadan, which is about 65%, and only 17% check their blood glucose more often during Ramadan. Yeah. And 17% of them, they check even less often, and almost a quarter did not check at all during Ramadan, their blood glucose. Okay. Another study done in the Saudi shows that the most common time when patients check their blood glucose is during the pre-iftar period, which is about 56.8, and this is followed by after an episode of hypoglycemia, about 30.21%, and then followed by the post-iftar period to look for postprandial hyperglycemia, 29.49%. Of note, that very few people actually check their blood glucose in the afternoon. Only 3.59% patients check their blood glucose in the afternoon. And this is an important graph. And this is an important diagram. I brought this up because this diagram was taken it influenced our decision of how we wrote the updates. So in a way that we know that hypoglycemia risk is highest in the last few hours of Ramadan fasting, starting from the afternoon and then to the last few hours before iftar, and then after iftar, the risk of hyperglycemia is highest, and this goes all the way until roughly about midnight. Yeah. So if let's say we were to prioritize our blood glucose monitoring time, these are the time of the day that we should prioritize our time. That is in the last few hours of Ramadan fasting, starting from afternoon, and then after iftar as well. So, in the original Ramadan education module, blood glucose monitoring is also one of the main components of the Ramadan education. And in the previous guideline, there were 7 points of blood glucose monitoring timing that were recommended, starting from the morning, before sahur, and then in the after sahur, in the midday or in the noon period, and then afternoon period between midday and iftar, and then before iftar time, and then after iftar or in the evening time, as well as at any point if there is any evidence of or any symptoms of hypo or hyperglycemia or being unwell. So some questions unfortunately remain unanswered. And this is what we have seen when we try to implement the recommendation to our patients, where we tell the patients, oh, you need to check your glucose 4 to 7 times in a day. But the question is, what time should they start to check? And would the frequency of testing be different with different medication and different hypo risk or not? So for example, important question is, would different blood glucose timing and frequency for different treatment modalities? Do patients at low risk of hypoglycemia, for example, if the patient is a combination of medications that all don't cause hypoglycemia, do they still need to monitor blood glucose as frequent as what was recommended? And if they still do, then how frequent they should be checking? Okay, which part of the day should be prioritized? And what about patients who are on CGM? Should they also need to check their blood glucose? If they do, what time? When should they check their blood glucose? So this slide was shown by Dr. Hassanin earlier, but I'm going to show you again. So as part of the new update, for patients who are using medications not causing hypoglycemia, we still recommend blood glucose monitoring more than once a day for patients who are using insulin secretagogue or basal insulin alone 2 times a day, for patients who are injecting once daily premix insulin 3 times a day, and patients who are injecting multiple daily premix insulin at least twice a day, or multiple daily insulin. And these patients who are on BD premix or multiple daily insulin, they need to check their blood glucose at least 4 times a day. The timing of the blood glucose remains the same as in the previous guideline. So I will show you the rationale on how we come up with these frequencies. Yeah. So for those who have low risk of hypoglycemia, for example, these patients are not on sulfonylurea and are not on insulin at all. So the blood glucose monitoring is recommended at least once or more in a day. And this is especially important for postprandial period because we know, as we have covered earlier, the eating pattern is going to change and people may take higher carbohydrate diet, and this can help them to understand how their body responds to different meal composition during Ramadan and during the time outside of Ramadan. Yeah. Do they need to check their blood glucose during the fasting hours? It depends. Yeah, this would be balanced against the low likelihood of hypoglycemia. If the patient has no symptom, if they are at low risk of hypoglycemia, then they probably do not need to check. But if they do have hypo symptom, then maybe they just need to check their blood glucose. Okay. So, for patients who are using insulin secretagogue or basal insulin alone, we recommend blood glucose monitoring twice a day, and the emphasis is given at the second half of the fasting hours, starting from afternoon until the few hours before iftar, especially in the last few hours due to high risk of hypoglycemia. The recommendations for postprandial blood glucose monitoring remains the same as other patients. So if let's say they want to know if their glucose hyper-excretion happens after iftar, they can do so. Yeah. So for patients who are using once daily premix insulin, so the recommendation is to check their blood glucose 3 times a day. Typically, patients who are injecting premix once a day, right, they would be shifted, or they would shift their injection timing to the iftar period. Yeah. So if you can imagine, if let's say they shift their premix timing to pre-iftar period, then the risk in the first few hours of fasting will be the same as patients who are on basal insulin alone. Yeah. So for the first few hours of fasting, and even in the last few hours of fasting, the risk gets higher. So they need to start focus on this period. Yeah.
Yeah. Okay.
However, they might still get risk of post-iftar hypoglycemia, yeah, as compared to SU or patients who are injected or treated with basal insulin treated patients. So because of that, we give emphasis to the last few hours of fasting as well as during the post-iftar period to look for the risk of hypoglycemia or hyperglycemia or even hypoglycemia in the post-iftar period. Okay, what about patients who are on twice daily or more premix insulin dose? Yeah, so we recommend similar monitoring frequency to patients who are on MDI. Imagine that patients who are on MDI, they require at least 4 times a day glucose monitoring outside of Ramadan, and this is what we've been practicing with all our people with diabetes type 1 and type 2, even if they are not fasting, even outside of Ramadan fasting period, right? However, during Ramadan, the midday of prandial insulin is omitted because of the fasting. So therefore, their insulin kinetics will be the same as people who are on premix insulin. So it means they will have 1 prandial dose in the morning, 1 prandial dose in the evening, and then 1 basal to cover throughout the day. But then again, we also know that because of the inflexibility of a premix insulin, the risk of hypoglycemia is actually higher in people who use premix insulin during Ramadan, because you cannot individually adjust the dose of the basal and the prandial doses. And hence, therefore, the frequency of monitoring for patients who are on BD premix insulin should be at least similar to patients who are on multiple daily injection or even more if required. Okay. For people who are on multiple daily injection, the minimum requirement is to monitor their blood glucose at least 4 times a day. Yeah. And the rationale for this is because even outside of Ramadan, some patients, especially type 1, they can monitor their glucose up to 6 or 7 times in a day. and if they need to check more often, then we certainly recommend that they want to check more often. Yeah. So, if let's say prenatal dose is given during sahur, right, then this patient will be at risk of getting post-sahur hypoglycemia, and therefore these are the period that we want to look out in the morning also. They may also get post-sahur hyperglycemia if the dose reduction is too much during after sahur period. So you might also want to see what's the effect on the insulin dose adjustment during that time. Yeah. The risk of hypoglycemia during mid-afternoon and pre-iftar remains elevated and remains highest for people with type 1 and type 2 diabetes on MDI, as well as people who are on BD premix injection, and this requires strict blood glucose monitoring. Again, the risk of hypo and hyperglycemia remains elevated throughout the day, including in the pre-iftar, post-iftar, and even late at night period, and this requires round-the-clock glucose monitoring. So for most of these patients, we recommend at least 4 times a day, if not more. And of course, preferably if CGM is an option, then we certainly recommend a CGM. What about other times to check blood glucose? So the recommendation is the same. We recommend to check during symptoms of hyper or hypoglycemia, during any episode of acute intercurrent illness or feeling unwell. And we also added whenever CGM detects a low reading of less than 3.9. Yeah. Including asymptomatic low sensor glucose, that we recommend patient to check their glucose. Okay. One important situation to consider if, let's say, the glucose is nearing hypoglycemia range, but the arrow is downwards. Yeah, because of the lag time behind blood glucose and interstitial fluid glucose. So these are the situations that the patient might still want to check their blood glucose as well. So moving forward, we hope that this new update offers greater clarity when we communicate with our patients. So when they ask if I'm on semaglutide, for example, how frequent should I check my glucose? If I'm on metformin and gliclazide, how frequent should I check my glucose, and what time when should I prioritize the timing? Yeah. But however, a lot of this is opinion based and based on the consensus of the writing group. And of course, we need more studies to validate the results of these recommendations. Last but not least, again, I would like to highlight that we are having another conference next weekend in Malaysia. This is available for both physical and online attendees. So if you are interested to join online, you can scan the QR code, and then we will cover some other additional topics that are not discussed in this conference for next week. Yeah. So with that, I'm open to Q&A. Thanks.